This is Dr. Doherty. I'm a board-certified plastic surgeon. I'm here today to talk to you about Kybella, which is a new FDA-approved injection treatment for double chin fat. So this is our patient. Ideally, a patient is young and healthy and has a very focused area of chin fat, and also does not describe their neck as a turkey neck. And our patient today fits that criteria. What I look at is for nice, healthy skin that's thick and will recover from the treatment well in an isolated, focused area of fat. I'm going to have the patient tighten her jaw, and this shows an isolated area of fat, and she will do quite well with this treatment. So patients shouldn't expect a significant amount of discomfort with this treatment. I apply numbing and or ice to help alleviate the discomfort from the needles. Patients should also know that this is a series of treatments. They should expect between 2 to 4 treatments done every 4 to 6 weeks, and ultimately they'll start seeing some initial results after the second or even into the third treatment. So evaluation of the anatomy for this treatment is extremely important. We want to make sure we focus our injection to simply the submental fat. So what I highlighted was the thyroid cartilage here, thyroid cartilage, the hyoid bone. This is the submental crease. I've isolated a no treatment zone, which is right along here, which is where the marginal mandibular nerve lies. We will not be injecting there. In addition, I've outlined the lateral or outer parts of the injection area by where this patient's marionette lines would be. In addition, I've outlined her sternocleidomastoid muscle to just define the entire anatomy of the neck. So the next part of the procedure is me marking the injection points. I'm using a marking template, which I'll apply to the area and get wet with saline, and that will leave a temporary tattoo on the surface of the skin, again showing where I'll place my injection points. I'm just getting this wet with saline, so then the tattoos will stick to the patient's skin temporarily. Okay, so the patient's ready for injection. I've injected her with numbing, so about 4 to 5 cc's of 1% lidocaine with epinephrine was injected in the space that I'll treat. You can see the effects of the epinephrine, so the blanching. And what I will do now is inject each of these spots here, and we'll see the treatment after. The needle is injected into the fat, so this is not a dermal injection. So I'm injecting each spot right next to the tattoo in the fat, and each injection spot is 0.2 mLs. Nice and slow, and the patient's tolerating it quite well. Here's one more. And that's all there is. So we just finished this patient's first Kybella injection, and she did quite well. She had 2 vials injected after she had 5 cc's of 1% lidocaine with epinephrine injected, and she did well. How did it go?
Great. I didn't feel any pain at all with the Kybella injection. The lidocaine, I felt a pinch here and there, but the Kybella was pain-free.
So that's pretty much a typical response, and that's what we look for. This patient will come back in 4 to 6 weeks, and she'll likely have another 2 vials injected. And she'll have a neck brace on tonight that she'll just wear tonight until tomorrow. She should expect swelling for the next 24 to 36 hours, and then numbing will wear off in the next few hours. Again, this is Dr. Doherty from Boston, Massachusetts, talking about Kybella. Thank you.